No single explanation can capture the full range of human experience or the challenges we face in practice. Many different factors can keep a client stuck, making inner work difficult or at times completely inaccessible. Resistance can come from a variety of places, and here, of course, we are focusing only on the psychological side of things. Biology, of course, plays a role as well, even though that's outside the scope of this course. Neurodiversity, cognitive factors, hormonal shifts, medications, and their side effects, all of these can shape how much capacity a client has for this work. This connects directly to our wider assessment of strengths, vulnerabilities, and limitations. And here we need to be careful. It's surprisingly easy to either underestimate or overestimate someone's ability, or to mistake a biologically driven difficulty for something purely psychological, and the other way around. Neuroscience also shows us something important. The part of the brain linked to persistence, the other side of resistance, anterior mid-cingulate cortex. It actually strengthens when people repeatedly do the hard things they would rather avoid. The opposite is also true. In states of apathy, or in some neurodegenerative conditions, this region tends to shrink or lose function. This area is deeply tied to persistence, stability, willpower, and the will to live itself. It helps us see resistance not just as a psychological pattern, but as a process that can either build or erode neural capacity for change. But if we set aside the label, what remains, especially when we look through the lens of the psyche's internal dynamics? Take a moment to recall one of your so-called highly resistant clients. Now that you have them in mind, ask yourself, are they truly resistant? Or are they trapped in the fragmented remains of their character structure, caught between protective and wounded parts? And if so, why? What actually is a highly resistant client? Highly resistant client is usually someone who grew up in an environment that forced them to build a rigid, inflexible character structure. At first, it was an adaptation, a way to survive early relational or environmental conditions. But over time, what once kept them alive hardened into an identity. Not just a coping mechanism anymore, but the very lens through which they see themselves and the world. Whatever form it takes, the client's character structure is the psyche's best attempt at survival, given the conditions it had to face. When a client sits across from you, neither of you knows all the forces that shape them. What they do bring, however, is a structure, a kind of psychological museum, its walls lined with echoes of the past that still shape the present. In many cases, this structure is no longer needed, but because it has become so deeply blended with their identity, the client does not know any other way to exist, nor are they fully aware of the parts that hold it up. What they do notice are the moments when certain parts get loud, especially in the form of psychological pain, distress, or other disturbances. These are signs that something inside is asking to be seen. In the most general framework, we can distinguish three core positions that shape the organization of the psyche. Identity foundation. As a protector, the client's sense of self is organized around a protective part that keeps wounded parts outside their identity. Identity foundation. As an exile, the client is fully identified with a wounded part and interprets life entirely through this lens. Identity foundation. Switching between protector and exile. The client alternates between identifying with protectors and wounded parts, sometimes gradually, sometimes within moments. To give you a feel how this structure looks in practice, reflected through identity foundation, I'll now present a few brief examples. These sketches will help you recognize the kinds of dynamics that might be playing out beneath the surface of your client's psyche.